I think there's a couple of things, and one is that we need to continue to focus on making sure that we provide high-quality services that our members need and want. And of course, there's a lot in that, figuring out what it is that they want, but I think that needs to be a major priority. The other is that we need to continue to focus on being a leader in the profession, particularly driving practice change and supporting an environment that will facilitate practice model change in the state. I think the important things that I'd like to focus on are some of the issues with regard to the strategic plan. The board over the last several years has done a lot of work developing that strategic plan, and there's a number of initiatives that are poised for implementation. And I think that my role as president would be to help make sure that those kinds of things get implemented. Things such as the initiatives that have come out of the Patient Safety Task Force, some of the legislative initiatives with regard to tech certification and registration, those kinds of things. I think they need to continue to be high priority for us. I think that it is a very exciting time to be a pharmacist. I think that practice model change is critical for us. There's a lot of societal need, and of course the healthcare system is extremely expensive. Healthcare costs are tremendously expensive, and we need to find ways to help reduce those costs. I think pharmacists play a key role. One of the areas in which I'm particularly interested is the whole issue of transitions of care and making sure that as patients move from our inpatient setting to other venues, that we've done what we as pharmacists can do to make sure that that happens safely and that patients can make the best use of their medications while reducing the risk for adverse events as well as readmissions to the hospital. There are tremendous roles for pharmacists to play in the inpatient as well as the community settings, and we need to work towards making sure that we have an environment that is supportive of the kinds of changes that we need to make. I've already mentioned the issues with technician certification. That also involves the technology and information system support to help us to make the kinds of changes that we need to make and to support the practice as we believe it needs to be. So I think it's critical, and I think it's a very exciting time to be a pharmacist. Active involvement is important because MPA is one of the venues by which we as individual practitioners can make our wishes known, and in terms of advocacy. I think that's critical. We need to have a voice that our politicians hear. We need to have a sort of united front to present our issues and to move our issues forward. And involvement in organizations like MPA in particular are very effective ways for us to do that. And I think that it's part of our professional obligation to join and not just put our name on the roll, but to get actively involved in the association. This is also a venue by which we can move our profession forward by coming together to brainstorm, to network, to work together to achieve common goals and objectives. I think that we can move the profession forward and achieve the kind of practice that our profession is visioning.